Today's presentation is going to be on diabetes, just defining the different types of diabetes out there. Many times people will come and tell me, well, I just have a little bit of sugar in my blood, or doctor told me I have borderline. I really want to define those for you. I also tell you what are the numbers to be diagnosed with it, because you might be surprised when we take a look at some of the numbers and really what else is involved as far as being diagnosed with full-blown diabetes. I'm going to explain the treatments of them as well, and at the very end I'm going to give you all some websites that you all can definitely get some good information from the websites. So let's take a look here on our Prezi here. This is just defining what diabetes is, and most of us know it. It's a condition in which there's too much sugar or glucose in the blood. And we use the term glucose in the hospital instead of using sugar, but sometimes we still use the word sugar. But the body doesn't produce insulin, or it's unable to use the insulin that it does make effectively. And I'm going to define those types of diabetes here in just a little bit, because I think many times we can get confused about that. As a result, glucose is going to build up in the blood instead of being absorbed by the cells in the body. Diabetes is not curable, but it's definitely treatable. So how does the insulin work? As you can kind of see on the picture here, when you're eating the food, it breaks down and it turns into what we call sugar, but many times what we call it here in the hospital, we call it glucose. And with the help of insulin, it's going to pick up that glucose and get it into our bodies, get it into our cells in our brain, and our muscles, and our fat cells. That's what insulin does. It picks up that food and feeds our body with it. If you don't have that, then that sugar is just going to build up. And we'll talk about the symptoms. Ugh. How do you feel when you have high blood sugar, when you don't know that you have diabetes or not? We'll talk about those symptoms here in just a little bit. The three main types. Let's talk about the three main types of diabetes. There's type 1, type 2, and gestational. So let's first of all talk about type 1. There's definitely a difference between the type 1 and type 2 diabetes. As you can see on the definition here, the beta cells of the pancreas, they no longer make insulin because the body's immune system has attacked the beta cells and has destroyed them. So definitely a person with type 1 diabetes, they're insulin deficient. Type 2 diabetes usually begins with insulin resistance, which is linked to excess weight, in which the muscle, liver, and fat cells, they don't use insulin properly. The pancreas, it keeps up with added demand by making more insulin, but in time it loses the ability to produce enough insulin in response to when we eat or rises in the blood sugar. So as you can see, type 1, no insulin on board. But type 2 there is, but as you can see, it's not working like it's supposed to. And this is the other third main type of diabetes called gestational, and many of us have heard of that before. It's just with women, so men don't have anything to worry about for gestational. Develops only during pregnancy, and it's really because the hormone levels, we've got such a surge of hormone levels going on in our body that the insulin can't keep up with that to help keep our blood sugar levels down. The OBGYN will order this test to be done in a certain trimester whenever the lady is pregnant, and I want to say it's usually closer to the third trimester. And I remember whenever I was pregnant, my insulin needs went way up in my third trimester. Okay, let's go on to, oops, sorry about that. There's a couple other types of diabetes. Two other ones that are listed on here, we don't see them as commonly. This one we don't, the other one we do. We'll talk about that in just a second. But it's called latent autoimmune diabetes in adults. That's a mouthful. LATA is what you could call it. It's where someone shows signs of both type 1 and type 2 diabetes. It's a slow progression of the autoimmune beta cell failure. So they're going to need insulin eventually. And it may be years after they've been diagnosed that they may actually start insulin injections. But it can be a little challenging for doctors because this person is showing symptoms of diabetes, but it's like they got a little bit of type 2 and they got a little bit of type 1. So there is a condition or a type of diabetes, and this is what it is right here. Now this one is common, prediabetes. I think before this was actually turned by the American Diabetes Association, many times people would call themselves borderline, or I got a little touch of sugar, or I got a little impairment. But now the actual term is called prediabetes, or impaired fasting glucose. It's when the blood sugar levels are higher than normal, but not high enough to be diagnosed with full-blown diabetes. A person with prediabetes is at risk for developing type 2, and many people develop type 2 diabetes within 10 years after being diagnosed with prediabetes. And I'm telling you, I don't ignore when it says on here, my blood sugars aren't high enough to be diagnosed with diabetes. Don't ignore it, because it will develop into that. And you all probably know of somebody, or maybe even yourself, that maybe that's happened to. So you can lick it. You can take care of this, what we call higher than normal blood sugar, but not high enough to have diabetes. You can take care of that now and do away with your risk of getting type 2 diabetes. So don't ignore those numbers on there. So how are these diagnosed? And this can be, I get this question asked often whenever I see people at the office, because they say, well, the doctor said I had this, and then they said I had that, and I don't disregard what the doctor says. We do follow what the doctor's guidelines are. But for you all to know from American Diabetes Association, these are the criteria for someone to be diagnosed with diabetes. So the first one here is if you have a blood sugar, what we call a fasting glucose, if you have a blood glucose of 126 or higher and you have symptoms, and we'll talk about those symptoms in just a little bit, then you can be diagnosed with diabetes. Or the other scenario is, again, you have a blood sugar of 126 or higher on 2 separate days of testing in the doctor's office. So those are the ways that somebody can be diagnosed with diabetes. Fasting plasma glucose can also be used to diagnose someone with prediabetes. And again, what are those prediabetes numbers? 100 to 125. And I'm telling you, I see people all the time, they just blow that off and they're like, oh, it's just a little high. If you don't get it now, you're going to be getting full-blown diabetes. When you get diabetes, the damage is done. You can't turn it back. Now, you can turn back how you're treating it. You may start on a pill for treating the diabetes, and you do so well that you can get off the pill, and you can just watch your diet and exercise, but eventually you're going to go back to the pill, and eventually you will need insulin. So I really, really encourage people, if you have these numbers right here, get on board. Let's start getting those down. Another test that can be used in diagnosing diabetes, but here's the thing, it's only for diagnosing type 2 or prediabetes. You've heard of hemoglobin A1C. A normal hemoglobin A1C is around 4 to 6%. And you can kind of see our chart here. If you have a hemoglobin A1C of 6%, that's saying your blood sugars have been running around 126. Is that normal? No, it's not. Remember, to be diagnosed with diabetes, it's 126 or higher. So 6% is not a normal number. Hemoglobin A1C measures your blood glucose over the past 2 to 3 months. You don't have to be fasting for this test. So I like this one because many times it's kind of hard to get people to come into the office fasting. It's at the end of the day and they've already eaten. So this test is good for someone that hasn't been fasting. And again, this test is not recommended for diagnosing type 1 diabetes or gestational. It is a test that can be used for diagnosing type 2 or prediabetes. And these are the numbers here. For type 2 diabetes, they have to have an A1C of 6.5% or higher. For being diagnosed with prediabetes, they have to have an A1C of 5.7 all the way up to 6.4% to be able to use an A1C in diagnosing prediabetes. Last one, oral glucose tolerance test. We more commonly see this women that are pregnant. OBGYNs always use this test. They have a certain time during the trimester that they're going to order this test on their girls that are pregnant. But it's a 2-hour test that checks your blood glucose before and 2 hours after you drink a special sweet drink. It's really sweet. It's pretty thick. It's a really sweet, thick drink. And this test tells you how your body uses glucose. To be diagnosed with diabetes, at 2 hours after drinking the sweet drink, your blood sugar has to be 200 or higher. To be diagnosed with prediabetes, at 2 hours after drinking the sweet drink, if you have a blood sugar between 140 and 199. To be diagnosed with gestational diabetes, it's really going to be dependent upon your OBGYN and which guidelines that she goes by. If she goes by the American College of Endocrinology, of Gynecology, or American Diabetes Association. Their testing guidelines, the ACOG and ADA, there's just a hair bit difference in their blood sugar numbers on there. So as long as your OBGYN is going by those guidelines, which they are, their OBGYNs are so good, they follow those testing guidelines there. I didn't list them all because it's pretty lengthy. But that's what they go by in using the oral glucose tolerance test. All right, are there symptoms of diabetes and prediabetes? Well, everybody in here could agree, yes, there definitely are symptoms of it. If you know of somebody, or maybe even you yourself, know that what the symptoms are like for diabetes: increased thirst, increased urination, unexplained weight loss. This is more common with type 1 diabetes, just because of the fact that the person with type 1 diabetes, as I mentioned, they're not getting insulin. It's shut down. They're getting food because they're taking food in, but that food is just staying in their blood. But the insulin is not there to get it into their cells. So what the body does, it's like, I'm starving to death. So then the body goes into another mechanism, so it starts to break the body down, where it starts to break down muscle cells. And so we get the unfortunate, what we call unexplained weight loss. So that's more common with type 1. I've seen it in some type 2s, but it's more common in type 1. Fatigue, just wiped out. Hardly any energy at all to do anything. Blurred vision, increased hunger, or cuts or sores that don't heal. Those are common symptoms with diabetes. You don't have to have all of them to be diagnosed with diabetes. This one can be a little frustrating. It can go either way. Symptoms with prediabetes. It could be you do have some of those symptoms that I just showed up there, or you may not have any at all. And it's been really a challenge to try to convince people when they come in to see me, because the first thing they'll tell me is, I don't have diabetes and I don't have prediabetes either. And it's like, oh, but the numbers show it. But they're like, I don't have any symptoms. So it's hard to convince somebody that they have it and they feel fine and they don't have any symptoms. And that's what they're telling me in the office. So I do make a point to tell them, you a lot of times don't have symptoms, but then sometimes some people do. I did make a point on here to point out that some people with prediabetes may also have some symptoms, as I mentioned, or some complications associated with diabetes. It was not uncommon for me to see people in the office that had already had some type of, what you could say is a diabetes complication, like a heart attack, vision problems, like retinopathy. They've already had those problems. But now they're in my office, say 1 to 2 years later, and they have prediabetes. So I guess my point on this is I'm proud that you all that are participating in your wellness program, you're getting your labs done each year. And yeah, your glucose is on there. That fasting plasma glucose is on there. If it's not within that recommended range listed on there, don't ignore it. Get on top of it so that we don't get into prediabetes or full-blown diabetes. I put this up here because I would commonly see this, and I would say you all that are clinicians, y'all have seen this before too, with patients or maybe even somebody that you know personally. I'm not saying that this is everybody with prediabetes or everybody with diabetes has this symptom. I commonly do see it though for people with prediabetes and people with type 2. They call it acanthosis nigricans. I'm not saying that exactly right, but it's darkening of the skin. it is definitely a symptom that you see in people that are obese. Maybe some people that are overweight, but it is a symptom that's commonly seen in people that are obese, and it's darkening of the skin. It almost looks like that your skin's dirty, and you keep on trying to get it clean, and it doesn't come off. Or it may look like it's a bad sunburn, like this picture right here. But that is commonly seen in people with prediabetes or type 2 diabetes. And I had a young girl, she was a teenager in high school, and she had that, and she had no idea. She just thought that it was one of the best things. That may have been all she got from my appointment, but she thought that was one of the best things that I had told her. She said, I always thought my skin was dirty, and I would just keep on trying to wash it off, and it never would come off. And she said, nobody's ever told me that. Now, can this go away if somebody gets their weight down? That can possibly happen. I'm not guaranteeing that it possibly can, but it may not. So it could kind of go either way with that. But I just want to put those pictures up there for you to know that this acanthosis nigricans can be common under the armpits, in the groin area, and even around the neck. You can see this condition in prediabetes or type 2. Who's at risk for type 1? Definitely if you have a first-degree relative, mom and dad, brother and sister, with type 1 diabetes, you bet that gene can pass right on to you. My children, I have a boy and a girl, and they're definitely at risk of having type 1 diabetes. My question that I ask my doctor is, well, when do I need to check them? And he said only if they display symptoms. But you know, I'm a clinician and I'm a diabetes educator, and I'm thinking I need to check them every month. I need to check them every 6 months, which I do. I do a finger stick on them once a month. That's just, I guess, because I'm a diabetes educator. But he said if you see symptoms in them, like the ones I showed you all a while ago, being real thirsty, having to pee a lot, then they need to come in and be checked. So I share that with you all. If you have somebody in your family with type 1, you just be on alert of those symptoms of diabetes. And if they're, showing those symptoms, get them checked out by their doctor. An injury to the pancreas, like if you're in a car accident, just internal organs are damaged, like kidneys, your heart, pancreas, that can be damaged. I remember I had a girl when we worked at the diabetes center. She was in a bad car accident, and it damaged her pancreas, and her pancreas didn't produce insulin anymore, so she had to be on insulin injections. That's the only one that I have seen, but I'm sure there's others out there, other type of physical injuries that you can sustain to your pancreas. Diseases of the pancreas, like pancreatitis, cystic fibrosis, these too can cause your pancreas not to produce insulin anymore. And I would say that most of you all could say this, but I would see this often in the hospital. People with pancreatitis, they wouldn't get control of that, and just basically their pancreas shut down after that. I'm not saying it's very common, but it wasn't unusual when you put it that way. That we would see that in the hospital. Who's at risk for type 2? Look at my list. I've got a pretty big list here. I've got a lot listed on here. And in my opinion, a lot of these risks that are listed here are things that a person can change. And I'm not saying everything is. For example, right here, your ethnic group. You can't change if you're Alaskan. You can't change if you're African American. You can't change that. But they do find that type 2 diabetes is more common in these ethnic groups. We can't change our age. The older we get, the more at risk we are for getting type 2 diabetes. So you're going to notice there's some risk on here we can't change. There's a lot we can. A lot we can. Look at the first one we listed up here. Being overweight or obese. Yeah, can we change that? You bet. Does it take work? Yes. But this is definitely as I mentioned, it's not a curable disease, but it's a treatable and controlling disease. So getting our weight down can definitely prevent us from getting type 2 diabetes. Getting more exercise. It says on here, if you exercise less than 3 times a week, boom, you're at risk for type 2 diabetes. If women that have polycystic ovarian syndrome, they're at risk of getting type 2 diabetes. If a person has prediabetes or history of gestational diabetes, they're at risk of type 2. There's quite a few risks on here associated with type 2 diabetes. Last two sections on here, how do you treat type 1 diabetes? As I mentioned, type 1s, they gotta have insulin. Remember, their pancreas is not making any more insulin. The beta cells, let me put it this way, the beta cells are not making any insulin. They've gotta be on insulin injections. So they'd be on taking shots through a syringe, or maybe an insulin pen, or maybe an insulin pump. When I was first diagnosed, when I was 11, I was on multiple shots, and that got me good. I was on 2 shots a day, then I moved up to 5 to 6 shots a day. And people would look at me and say, oh, you've got it really bad. And what their understanding was of it, thinking that I've got to take a shot every 30 minutes. No. Every time I eat, I best better be taking insulin, otherwise my blood sugar's going up. So that's actually the way you do want to treat your type 1 diabetes. You want to make sure you're keeping it controlled by covering, when you eat snacks and you eat meals, covering it with insulin. Be sure that that person with type 1, they work with a registered dietitian, diabetes educator, because they're going to help you in knowing how much insulin that you need to take in relation to what you're eating. So that's huge on here as far as what about your meal plan. When I was first diagnosed, it was so stringent because I'm on 2 shots a day. Then when I learned more about carbohydrate counting, then I could eat pretty much when I wanted to and how much I wanted to eat. But I had to cover it with my insulin that I was taking. The downside of that is you can get in trouble with gaining weight because you can feel like you're going to eat all the time. I'm going to eat and I'm going to take a shot. I don't always recommend that, but if I've had somebody in my office and that's the only way I can get through with them and taking their shots, you better believe it. I'm going to work with them on that type of regimen in controlling their diabetes. You bet. Because otherwise I'm going to lose them, and they're just going to discount me. They're never going to come back. But using an insulin pump is another regimen. That's what I use now. Love it. A lot of flexibility with that. Testing blood glucose, huge. Test your blood sugar before and after meals. You need to test your blood sugar before you exercise and after you exercise. I used to make this mistake all the time. I go outside to do some yard work. Going out there, my blood sugar's 72. So if I'm going to go out there and do some exercise, am I going to be burning calories? You bet. So if I go out there and I burn some calories, my blood sugar 72 is going to do what? It'll start to plummet. Then I'll have a low blood sugar and I'm going to be all on the ground. So it is important to check before you exercise and even after exercise. Checking before bed is also a good time. Regular activities recommended, not just for type 1s, everybody needs regular activity. Routine checkups with your doctor and lab work. I'm not sure what the different doctors actually recommend, every 3 months, every 6 months. Some it may be a little bit sooner than that, but definitely the person with type 1 needs to follow up with their doctor regularly, with checkups and having lab work. Just want to throw up a fun slide up here because these are some famous people that have type 1 diabetes. Jonas, what's his first name?
Nick
Jonas, he has type 1 diabetes. And I don't know my hard rock guy right here, but he too also has type 1 diabetes. What I like about these two, and actually she does too, Mary Tyler Moore, they really try to promote people to do more research in diabetes, particularly type 1. So I just put some familiar faces up here that do have type 1 diabetes. I don't know what kind of treatment that they do, what kind of health condition that they're in, but I just thought it might be fun to put some famous faces that are out there that have type 1 diabetes. Type 2 diabetes, the treatments. Number one thing is a healthy meal plan, maybe to maintain their weight, or if they need to lose, they need to be on a meal plan to help them lose weight. Try to keep their carbs around 45 to 60 grams of carbohydrate per meal. Registered dietitian can calculate that. Regular activity, 5 days per week for at least 30 minutes per session. Frequent blood glucose testing. Usually the doctors will tell you how often that you need to check your blood sugar. it's not set in stone. American Diabetes Association, you go to their website, they can give you a pretty good idea on how often. I didn't put that up here because the doctor usually prescribes that, but you can go to their website and they'll give you, give you recommendations for people with type 2 diabetes. Sometimes people with type 2, that's all they need to do is just watch their meal plan and get active. Everybody, not just type 2, but everybody needs to watch their food intake and be active. But sometimes some people with type 2 might need an oral medicine. They all work in different ways, and it's so cool the different ones that are out there. And we're so blessed to live in the United States to have to be able to have access to be able to take medicines like this. But I just listed one up here. I didn't list all of them because there's lots. Even insulin. Sometimes people with type 2 will need insulin. These are some different ones here, and there's others that are out there as well. Then there's other injectable medicines like Insulin and Byetta. So there's lots of different types of medicine treatments for people with type 2 diabetes. And obviously regular checkups and lab work with their doctor, that is essential as well. Just put another picture up here of people with type 2 diabetes. And I like to point out that you've probably noticed with some of these that Drew Carey, that they've actually lost some weight. You probably remember what they used to look like. He doesn't look like that anymore. He has slimmed down. This is a slimmed down picture of Huckabee. Mike Huckabee? I can't remember his name. Mike Huckabee. But he used to be bigger than that. He was a governor in Arkansas, and he was diagnosed with type 2, so he started running and started watching his diet. I mean, the weight just dropped from him. Same with Larry King. He used to be heavier than that there. And this is one of the Jackson brothers, and he did too. Now, I haven't seen him out lately because he used to be on American Idol, but he too also did the same. Last slides on here, helpful websites. I'm not going to read through each one of them, but I have looked at these websites, and you can find a lot of good information on there. So I thought, if anything, you guys will have today's handout, and it's going to have these listed on there. But if you actually are watching this on our Healthworks site, watching this video, you can also print today's PowerPoint. You can print that off. But these are good websites that you can go to on here. This is more so looking at a lot of food type information, recipes, meals, menus. So these are some websites that you can use for yourself, or maybe even for some of your patients on there as well. And that's all I have for you for today on diabetes, because November is Diabetes Month, and I hope this information was helpful for you all today.